Okay, so I'm going to show you a few simple techniques you can use for a back massage on your patient. So I've already set up the bed. I've raised the bed up to a level that's going to be comfortable for me, and I've lowered the side rail. And I've also set up pillows along the sides so that my patient can hug them and be expose her back but not be straight onto her stomach, because that might be uncomfortable for a hospitalized patient. So I've already asked her permission, and she said it was okay. So I'm just going to undrape the parts that I'm going to be massaging. So that's just her back. And I might even throw a towel over her for that extra little bit of weight and security so she knows she's not going to be exposed. I've just gotten some lotion from the hospital supply room. And I'm just going to warm it up a little bit in my hands. It's going to be a little bit cold, I'm sorry. And you just want to use broad, long strokes, nice and slow, because that's going to be more relaxing than fast, brisk strokes. Does that feel okay, Wafa?
Mm-hmm.
You always want to check in with your patient. Make sure the pressure is okay. Make sure they're not experiencing any pain from what you're doing. And you always want to make sure you stay off the spine. You can do little circles around the lower back. And you can do those all the way up the spine. The area in between the shoulder blades in particular tends to have a lot of knots, so you can spend some time up there. And you're going to notice that as you keep doing these strokes on their back, the lotion's going to get absorbed and you're going to start to stick a little bit more to their skin. So you want to reapply more lotion because you don't want to cause any skin tears. So once you're done with the massage, make sure you pull their gown back down. You might want to do some compressions on them. So I'm just tractioning with my hand on her hip here and kind of pressing down and up, which is a nice little stretch for the back. So when you end the massage, you don't want to just suddenly take your hands off of the patient. So you just want to gently release that pressure. Alright. You okay, Wafa?
Yeah.
Alright.
Thank you.
And that's it. Okay, so if you have a patient that's sitting in a wheelchair or a chair, it's a good opportunity to give them a shoulder rub and or a head massage. So to give them a shoulder rub, you're just going to be grabbing their traps between your thumb and the rest of your fingers, and you're just going to give them a good squeeze. You want to check in with your patient about the pressure. Is that okay? You can go down the arms, get the deltoids a little bit. And as you can see, I'm doing it over her gown, so you don't need any lotion for this. You can go down between her shoulder blades and get her rhomboids. And you can also get her neck. Is it okay if I touch her forehead?
Mm-hmm.
Okay, so you just want to provide a little bit of support, and you're going to be using the same kind of motion, scooping up her neck with circles. And then you can also just press up into her occiput using your thumb and your forefinger again, providing a little bit of traction for her neck and her head. Does that feel okay? Mm-hmm. Okay. And then you can also provide a scalp massage, and you're going to use all 10 fingers. You're just doing little scrubbing motions like you're shampooing your head. Once again, you want to keep it slow because this is going to be more relaxing than if you're scrubbing really fast. But it is very similar to shampooing your hair. And you're trying to move the skin over the scalp, not just the hair. It's going to be more relaxing that way. Make sure you get all parts of the head so nothing gets left out. And that's how you give a head, neck, and shoulder massage. Okay, so now I'm going to show you how to give your patient a hand massage. So you're just going to get a little more lotion. And you're just going to be spreading it on their hand. And really, I'm using this part of my hand to massage her. Just alternating strokes, nice and slow. Go up the forearm a little bit if you'd like. And down each finger. You can do circles down the fingers and a little bit of a tug at the end. Now this could feel really good with somebody who has arthritic hands, to give those knuckles a little bit of extra attention. And you can turn their hand over and massage the big muscles of the palm. And those are the basics of a hand massage.